Well, in my community, we tend to focus on our youth and we tend to focus on our elders. So I see like the group in the middle that doesn't get the focus, right? Which should be also included in the cancer prevention program, is to bring more to them. Okay, for example, I have a cousin who is went for a bunch of tests, right? And so there's the possibility of cancer. So just that word, cancer, terrified her. So it took a lot of, because her niece is one of our nurses, so it was getting her niece to take her out into the tests to see whether it was malignant or not, right? And thankfully, it wasn't. But it was very scary for her. She just all she heard, I think, in her mind was cancer, and she shut down. It's just bringing that knowledge out so that it's not something that you have to be totally afraid of, right? And it's that fear to help them get over that and to help them go through the process of all the testing and whatever not. Is what I would love to see is to have like an advocate or someone to hold your hand. I'm not sure the word for it. Just to help you navigate the process of going to the hospital and going through the tests and what a mammogram is and what any kind of test is, just, because it's scary for you never having to do it. They have a bus that comes in to do that, so you don't have to leave the community, which is another big thing, is to having to leave and go somewhere else. To bring it into our community, for me, is a big thing too. So our people don't have to leave and just can keep continuing that. It has to be continuous, right? It can't you just give the funding for a year and then, take it away. It has to be continuous because it's not going to go away. Cancer isn't going to stop. It's not going to go anywhere. It has to be continuous. I think it's just different ways that you can bring it out to the community, right? Different learning aspects of getting it out to community members. It's hard for me to make somebody try to do something, right? Because it's a personal preference. It has to be your own health. You have to think about your own body spiritually, mentally, and all of that, and that's something you have to take care of. I tend to be more traditional. I like to go into plants and nature and that's my personal preference, right? I think every individual has to find their own way. But I mean, the knowledge is there, right? There's people that are willing to help you in this. So it's just getting over that fear and helping yourself.